Hi, Bar.
Hey, how's it going?
Good. How are you?
Good. Found a little exam room to
Yeah,
log on for, but
awesome.
I'm just pulling
You
up.
made it back. Your flight was okay.
Yeah, it was. And I made it on time. So just putting everything on silent. How was your DC stuff?
Mm, it was amazing. Yeah, I highly recommend.
Yeah.
The family medicine people are so fun. So yeah, I'll have to connect you. We have to like do this gala next month and all this stuff. So
Hey guys.
Hi.
Hi. Hello. Hi. Good to see you again, Bar.
Good to see you too.
Hi. And hi, Caitlin. I'm Linda.
hi, Linda. Good to meet you. Thanks so much for hosting this today.
Oh, yeah. Great. Thank you so much for being here. So, Academy, do you know about the Academy of Medical Educators? Yeah.
Yeah.
So I've been helping Shanta just get, figure out speakers, and Bar and I were at a conference last spring, I think, right?
Yep.
And started talking about, well, we should do this. We might ask you to come do it again for family medicine. I'm thinking too, like family medicine wants to know a lot about this too, but that's for another time. But
yeah.
I'm really happy that you're here. Hi, Beth.
Hello.
Hi, Beth. I'm Linda. Nice to meet you.
Nice to meet you too.
So we always like people to come on just in the, just make sure everybody's here. Usually they sort of like administrative person, Riley is here too. So hopefully she'll show up too. But is anybody like, you'll be sharing slides, I guess.
Yep.
Does anybody want to like practice? Yeah, there we go.
Yeah, I'm just making sure this works, right?
Yep, that's perfect.
Okay.
Is it
Great.
good for everybody seeing that? Yeah.
Mm-hmm.
And then you'll be driving the slides, Bar, is that right?
I'll be driving the slides. Yeah.
Well, great. And I love how you structured it with UME, GME, and CME. That's like such a medical educator's mind. How to teach across the spectrum.
Uh-huh.
Yeah. All right, good. Anybody have any concerns about today? Questions?
About how many people typically log on?
It's highly variable, and I don't know what the registration was today. Riley is new in her role, so I usually, like for the prior people, they would give me update. They would give me and Shanta, and there's another emergency medicine, Molly Thiessen, who would do that, would be part of it too. We would get like reports of like, 47 people have registered, whatever, it can be very variable. So I don't know if Riley comes on, we'll be able to ask her how many people are registered today. And it's usually, as you can imagine, it's usually not the full registration amount of the people who actually ended up finishing up in clinics and going to the bathroom and getting in front of their screens. And by the time it's usually a little bit less, but yeah, so I actually don't know what the, what the number is, but there's Riley. Maybe she can tell us. Hi, Riley. Hey, Riley. Bar was just asking, do you know what the registration number is for today?
The number, let me check.
Zoom land is harder than in a busy conference room. So we'll get started. Hi. Good afternoon, everyone. Welcome to Academy of Medical Educators Grand Rounds. I'm Linda Montgomery. I'm the Vice Chair of Education for our Department of Family Medicine and one of the planners of this event. Thanks for joining us today for this exciting talk. Help me welcome our speakers. We're joined here by 3 speakers today. Dr. Beth Gillespie is a hospitalist at Denver Health and an assistant professor with the School of Medicine. Her focus is integrating climate change and health curriculum at the UME level. Dr. Caitlin Rublee is an assistant professor of emergency medicine at CU and the assistant fellowship director of the National Climate and Health Science Policy Fellowship. Her focus is leadership development in planetary health at the GME level. And Dr. Chekuri is an assistant professor of family medicine and is now co-director of the new Diploma in Climate Medicine program at CU, where her focus is CME. All 3 of these wonderful doctors are former fellows of the CU Climate and Health Program with keen interest in environmental justice and health equity. I really appreciate that they come from different disciplines and they are presenting different aspects of medical education. So thank you so much for that wonderful structuring. Thanks for being with us and welcome.
All right, so I'm going to just quickly share our slides. So I think you should all be able to see them, and I will let Beth start us off.
All right, thank you, Bar, and thank you, Linda, for that kind introduction. So as Linda said, we're going to be telling you all about our perspective of how to teach climate medicine from a UME, CME, and GME standpoint. And we're thrilled to have your attention for this discussion and a short Q&A at the end. So we have no disclosures. This is a list of all of our objectives. You should have gotten them in an email prior to this event, so we won't go over them. Next slide. And just like to take time to thank everyone that helped make this happen today, especially Dr. Jay Lemry and Dr. Rosemary Rochford, who have been thinking through how to create a climate and health program for several years. And finally, last year it became a reality with the help of Dean Riley. Next slide. So what is climate change? So in a nutshell, it's the phenomenon in which burning fossil fuels leads to rising greenhouse gas levels that trap greenhouse gases in the atmosphere and warm our atmosphere, essentially creating more layers of a blanket around the Earth. And this leads to the more greenhouse gas emissions we add, wrapping more layers of the blanket. And so we get these rising temperatures, more extreme weather, and rising sea levels on the inner circle of this graphic from the CDC, which leads in the outer circle to more environmental hazards, some of which here are air pollution, increasing allergens, water and food supply impacts, extreme heat and severe weather. And these lead to the outer circle here of multiple effects on health. And as you can see, multiple systems are affected, and really all of everyone in the world is affected. The reality is, though, that most of us here are going to be just fine. And so as you can see in this graphic from the National Climate Assessment, certain groups of people are more at risk than others. And we think especially about communities of color, including Indigenous tribes, who tend to live in areas near industrial plants or transportation hubs, where they're exposed to industrial pollutants and other air toxins. And children and unhoused individuals and older individuals and all people with certain chronic medical conditions are more at increased risk of extreme heat-related illness. And then finally, older people and those with poor mobility are more vulnerable to the risks of extreme weather. Next slide. And so what risks are we considering, especially for our patients in the Denver Aurora area? So heat is a big one, and this is one that we've all seen the effects of. For me, I've seen a number of people with heat stroke. I took care of a 65-year-old recently who came in with acute respiratory failure and acute renal injury because he had passed out in the heat on a 100-degree day, just waiting outside for his car to be repaired, and his body temperature was much higher. And this is in an area where, you know, we're not really used to this extreme temperature. We had in 2020, 75 days over 90, and that was 30 days higher than the 30-year average. And we're gonna see a lot more heat illness as the years go by. And next, poor air quality is another big one. Ozone and PM 2.5 are two of the pollutants that are tracked by the EPA that are most harmful to human health. Ozone is a big one for our area. The American Lung Association in this year ranked Denver Aurora as 7th worst in the country out of over 220 metropolitan areas for ozone. And so this is something that we can really help educate our patients and our trainees about. And PM 2.5 is also important. This is something that is found in the wildfires that we get almost every summer. Thankfully, this one was a better one. But you know, I have a lot of patients every year that I talk to who are just worried to go outside because they're worried that their lung conditions are going to be triggered by the air that they breathe. Drought is another big one. We're in the midst of a historic drought, and this is something that contributed to the grassland fires that we had in the middle of winter, which decimated close to 1,000 homes. 3 of these belong to my colleagues and their families. Next is extreme weather, and this is something that doesn't really happen that often here, but it does happen. And we had boulder mudslides in about a decade ago. And also related to this, our immigrant health clinics take care of a number of people that are fleeing unrest and drought-related issues in their agricultural economies. And so drought and extreme weather are indirectly related because of the patients that we care for in our clinics. Next, I'll hand it over to Bar for some polls.
Yeah, so I'm gonna ask everyone to go, you can use this QR code to pull this up on your phone, or you can go to pollev.com/BC511. And I'm gonna just quickly stop sharing and go to the other screen. And so the question here that we'd like to pose to this group is, let me activate this, is
can you go back real quick for the QR? Sorry.
Yep. Okay. One
Or maybe.
Yeah, I think now the QR, I don't know how to get to it, and because this will deactivate.
Okay, never mind.
Maybe pollev.com/BC511.
Okay.
And so describe in one word how you feel about practicing medicine amidst heat waves, wildfires, and drought here in Colorado. So, yeah, I would say that these responses are, you know, what I think all of us would expect, given how much training we've gotten about this topic. And so this question of feeling unprepared and powerless is really what I think our program tries to address. We really think about what we're doing as focused on healthcare worker preparedness and really preparing our systems and our workforce to address this, you know, pretty overwhelming problem. But, you know, there are people that are experts in climate medicine and planetary health. And so we're hoping that we can show some sort of frameworks for how to think about how to tackle this. The next question is, sorry, one second. I don't know if I can. There we go. I have to activate it. There we go. Yep. And so it's how comfortable are you teaching about climate change and health? And so looks like we're a little bit, split across the board from very to neutral to not at all.
Or we can't, at least I can't see your slides.
Oh, whoops. So it looks like some people feel like they're very prepared, other people feel neutral and not at all. There we go. So you guys can see this, right? Yes. Mm-hmm. Okay. And so, yeah, we're really hoping to do is work with, the university and also medical schools and health systems, really both nationally and globally, to really change this to vary so that we're really preparing our healthcare workforce for the future and today. I'm going to go back to our slides. There we go. So I'm just going to quickly start with some definitions. So the title of our presentation is How to Teach Climate Medicine. And so what is climate medicine? Climate medicine is a critical new approach that aims to educate and prepare health professionals, hospitals, and communities to manage the health impacts of climate change. And then planetary health is a solutions-oriented transdisciplinary field that's focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems, on human health, and all life on Earth. So I really like to think of this as a lens that helps you see better what are actually the drivers bringing our patients into our exam rooms when they're coming in. And it's worth, I think this graphic is sort of helpful to really conceptualize what planetary health is. So a lot of times, we talk about public health, global health, One Health, and this is really almost all encompassing and really strives to work with practitioners across pretty much as many disciplines as we can. And so, a question whenever we talk about teaching something new is, what is the need for it? Luckily, there's a great student sort of grassroots needs assessment that's been that's actively being completed at medical schools across the country. It's called the Planetary Health Report Card. You'll hear a little bit more about it in a little bit, but this has really been, I think, a big catalyst for change across the country and really thinking about planetary health and why it needs to be integrated. And then there are multiple frameworks for education in climate change and health and planetary health. These have been published by the Planetary Health Alliance. There's one that was published by a couple of experts in the International Journal of Environmental Research and Public Health. And then there was a set of competencies that have been published by the Global Consortium for Climate Health Education out of Columbia University. And actually a lot of our CU faculty have contributed to those competencies, and so this is the one that we feel probably the most comfortable with. And it's not just that we feel comfortable, I also think that the framework that these competencies provide, they're like plywood. They offer a lot of structure, but they're also layered, and they allow for a lot of flexibility to be applied into health professional schools. So what are these competencies? I think the competencies, I'm going to talk about it almost like a curricular map, which can sort of help thinking about how to teach this. And so there's 5 different domains. The first one is really focused on knowledge and analytical skills. And so the question, I think the overarching question that this domain tries to answer is, what is climate change and what are its health impacts? How do we diagnose what the health impacts of climate change are? The second one is really focused on clinical practice, which is how do we manage these impacts, both at the bedside, but also within our hospital systems. And then the third one is public health practice. And then there's also another domain that's focused on policy and advocacy. And so these really try to address how to, again, think about these impacts at more meso and macro levels. And then communication and collaboration underpins all of these domains, because we really want to know how do we do all of the above effectively. And so for each of these domains, a lot of the people that we work with, a lot of our colleagues, a lot of learning objectives are being fleshed out for each of these domains. And we've also, some of our other colleagues, one of them is Rebecca Phillipsborn from Emory. She's actually done this amazing work of really mapping these out across all 6 ACGME competencies. So, you know, in terms of thinking about this curricular map, there's a lot to cover. And I think that's probably the first thing to note is the scope and breadth is actually a lot bigger than we initially might think. But we contend here at the CU program that really these 3 domains of, you know, what is climate change? How do we diagnose its health problems? And what do we do about it at the bedside and in our hospital systems, as well as how to communicate about it, are really the basics, the bare minimum that we would like every doctor to know, and every other health professional. And so you can sort of start to picture how this might look when we think about integration across the medical education spectrum. So perhaps in the preclinical years, medical students are learning about this first domain. And then as we get to the clinical years, they're starting to think about what they can start doing at the bedside. And then when we think about residency, it's not just it's a much bigger focus on clinical practice, but also what can we start doing at the health systems. And then in the fellowship and CME level, you really, you know, are trying to get the full spectrum of understanding these domains, and really at all levels, the focus on communication and collaboration. So that's not to say that a medical school can't focus on, you know, something like health policy or advocacy. I think, again, the structure is pretty flexible. And so every school program have different opportunities for tracks, rotations, electives. And so this is really sort of how we envision, at least sort of start to envision how to integrate across these different fields. So I'm going to hand it over to Beth, who's been working at the undergraduate medical level.
All right, thanks, Bar. And I'm going to go over some material that is already going to be familiar to Shanta here, because I shared it with the Curriculum Steering Committee. But like to start with the vision of TREC, which is on the next slide, and is I think we all know is the name of the new curriculum. So the vision is for graduating students to become physician leaders that are capable of transforming the health of diverse communities. And in this curriculum, we want graduates to be familiar with the transformative determinants of health and to understand how factors such as race and ethnicity, gender and sexual orientation, and housing status and poverty impact the care that we give, and present barriers to our promotion of health. And so I'd argue that planetary health is just as important, and environmental health, and it's just as important a determinant of health as these other aspects. And I'd also have to give a shout out to Shanta, because she really encourages everyone to think about, you know, what do we want physician leaders to look like? And I would argue that for being a physician leader not only means the ability to recognize the social, cultural, and environmental determinants of health, but also how to manage them at all levels. And this would include at the bedside, and also as advocates in the community, and on more national and international scales. Next slide. So at CU, Bar already mentioned the structure of the program. We have UME, GME, CME, and Bar has put a lot of work developing this, expanding this curricular map. But we also have the Science and Policy Fellowship, the Diploma in Climate Medicine. We also have in the CU area, a consortium on climate change and health, which is made up of researchers and educators who already have served and who will continue to serve as mentors and educators for interested students. And then I have to mention that a lot of the leadership on this has come from the students. CU Chase, for example, is an organization that was founded by students. And its mission is partly to educate the community on climate and health issues, and also to expand sustainability efforts at the university on campus. We have a local chapter for medical students for a sustainable future, and students are contributing to and developing curriculum. So at Denver Health, which was the original location of the LICs, one of the students created a learning module where students create an environmental health assessment of the community surrounding the homes that they're doing home visits at. And I'm hoping that this will expand to other LICs as Denver Health, as the LICs expand to other areas. One second-year student is doing his mentored scholarly project on air pollution and climate change. And also two students, at least two students, I should say, are working on their health equity community project on climate change and heat. And then Bar already mentioned the Planetary Health Report Card and that it was a grassroots student effort. This is something that that some ambitious students put together all the metrics for and submitted to create a score for us this year. So on the next slide is a snapshot of this year's report card. And we made the first page in the top 10. We scored 10 out of 33. And I'll just highlight that we got a C+ in curriculum. So a lot of room for improvement there, but Bar mentioned it well, or described it well. This is a needs assessment. This is where we are, and this is where we can go. She also mentioned Rebecca Phillips, born at Emory. You can see that they're right there at the top at an A. But other things that should be mentioned on this is in research, we got an A. So, we have these other areas where we're doing well, and this is a source of, I think, inspiration and also resources for us to look to that will, I think, provide a lot of the foundation that the curriculum can build off of. Next slide. And just to give you an overview of what goes into the metrics for the curriculum. So there's a general, which basically refers to the elective offerings. We have two now, one for fourth years and one for first years. How much do we teach about the health effects of climate change in the core curriculum? This would be the first column that Bar had on her curricular map. And then environmental health and effects of anthropogenic toxins on human health, drawing on the community effects, indigenous knowledge, and health inequities. And then how much do we teach about the carbon footprint of healthcare, which in the US makes up to almost 10% of US greenhouse gas emissions, which is almost double what high income countries' healthcare systems contribute. And then, where are there opportunities to improve on this? And then clinical applications, which we're already working on with this environmental health assessment and teaching students in electives how to take environmental health histories, and then how much administrative support is there for planetary health. Next slide. So there's already a lot of momentum for integrating this into our curriculum. We have one lecture, which will be repeated this year in core curriculum. There's already, this is already being addressed in the global health curriculum. I mentioned the fourth year elective, which is going into its fourth year this year. And we now have a first year elective that's being offered starting in January. Students at CU Fort Collins have a unique opportunity to interact with researchers at the One Health Institute and understand that overlap between animal health, human health, and biodiversity. And then we're hoping to perform a needs assessment at CU and understand more about what else should be on this list but isn't, because I'm sure there are many other examples of how passionate leaders are incorporating this into their curriculum without us being aware. And then I should also mention that I think there are some changes coming down the pipeline in the steps. One of the other graduates of the fellowship and of CU School of Medicine, Dr. Cece Sorensen, is now at the Global Consortium on Climate and Health Education, and she's writing test questions now for the ABME and is determined to incorporate some on climate and health, so stay tuned. These are some examples that are areas that we can incorporate planetary health into the curriculum. Just some kind of cutout things that we can do would be to add material to student orientations, like a workshop or a lecture. We've already added some preclinical slides. I'll give an example in a second. Clinical case examples, PBLs, service learning projects, and then we can expand the content in global health. And I mentioned some of these resources and tools that we have on campus, like the experts in our climate and health program, including at least one fellow every year who's on campus in the emergency department. We have to use the human power that we have. And then the Colorado Consortium for Climate and Health experts that I mentioned. And then Bar mentioned the curriculum that was put out by the GCCHE. They also put out a knowledge bank this year that many of us here also contributed to, but this is a really rich resource where, you can just kind of take piecemeal things like learning objectives, facilitator and learner's guides and assessment tools for all preclinical subjects. And then the Planetary Health Report Card metrics I mentioned, curricular map, and then interested faculty and students who are willing to teach this material. And then I had also thrown out there to the CSC, a representative to the curriculum committee that can keep advocating for this. This is just an example of, I admit, busy slide, but an example of a slide that can be just inserted into existing curriculum. So this was something that was, along with one other slide, incorporated into the immigrant health module in Health and Society. Dr. Janine Young put this together. And this slide just kind of complemented the case study that they were teaching about this Guatemalan family and how they ended up in their clinic. So what are some next steps? Again, I already mentioned this to the curriculum steering committee, but just to share it with a broader audience. So the course director survey needs assessment soon to come. And then addition to kind of easy things to do, piecemeal things to do, addition of this material to orientation materials. And then other orientation opportunities like clinical boot camps. And then a suggestion to add a student or faculty representative to the CSC and Planetary Health. And with that, I'll thank you and pass it on to Caitlin.
So I'm gonna just, before Caitlin jumps on, I'm gonna quickly touch on sort of where things are at a national level when thinking about integrating climate change and health education or planetary health into the residency level. And so I would probably describe it as the baby steps kind of stage. This is a tough nut to crack for sure, because while undergraduate medical education is jam-packed, residency training is even more jam-packed, and there's such a big focus on really patient care. And so to that end, programs across the country are starting to, I get emails all the time from different family medicine programs wanting to start to integrate this into their curriculum. And so a lot of times that comes in the fashion of a standalone lecture or a recurring lecture that occurs about once a year. There are some other sort of sessions that people get in tracks, and a lot of people have health equity track, that type of thing, or a global health track, and they'll start to integrate some of this education there. And then here at CU, we've launched this residency elective for residents can take it from across the country, and we have a lot of interest in this. Actually, a couple of residents have already taken this elective, and it's because the climate change and health education can be offered virtually, it allows the residents to continue any clinical work that they may need to do because of ACGME requirements. And then the other half of the time, they sort of do virtual and asynchronous learning with a focus on a deliverable, like writing an op-ed or testifying at a state legislature. Some of them work on their grand rounds or their QI, and they sort of integrate this into something that's already required. And so with that, I will hand it over to GME at the fellowship level to Caitlin.
All right, thank you both. And we'll just take a minute here and pause and make sure everyone's still with us because I know it's a lot. And it sometimes feels like word salad talking about climate change and health, and your schedules are already packed. And so it is my pleasure to take the next step forward and talk about the fellowship. Next slide. So really the fellowship as it stands now is an opportunity to develop networks, to invest in your own ideas, and to really get the time in our busy schedules to commit to action. What it looks like now is there are currently 5 fellows every year. Most of the fellows are 1 year, and there are optional master's degrees that can be done over 2 years, but the vast majority are 1 year. We have 1 in-person fellow through the Department of Emergency Medicine, and then 4 virtual fellows across the House of Medicine. Right now, we have emergency medicine, internal medicine, family medicine, neurosurgery, neurology represented. And really, it's getting us to get out of our silos and think about these complex, messy issues and how we can address them. On the one side, we have climate science, where we think about water scarcity and the impact of resource allocation and resource depletion, not only right here in Colorado, but on a global standpoint. On the second side, we have this growing burden of climate sensitive conditions. And as clinicians, we are forced to care for these patients with increasing needs in our clinics, in our emergency departments, in our hospitals, and even thinking upstream of like trying to prevent them from a public health standpoint. So our goal is very simple: to train leaders in this beast that be climate medicine. And quite frankly, we're paving the way. The fellowship started in 2017, and you can see already the structure that has been there through the generous support of the Climate and Health Foundation, as well as the School of Medicine, where we are cementing the infrastructure in order to make this possible for busy clinicians like yourselves to expand their ideas and get these individuals in the circles at the leadership tables where local, national, and international policies are being created with a health and equity lens. Next slide. There are really 3 pillars that I think about when it comes to this work. Number 1 is research. Now, the vast majority is not traditional R's and K's grants research. And quite frankly, from a federal level, there has not been a lot of funding for this climate and health sector, but that's changing. So it's thinking about research in regards to how do we get evidence that drives policy and action. It might be simply improving treatments for heat stroke when you get a dozen patients to your emergency department and have limited resources, supply chain and personnel resources. It might be thinking about working with your local energy company and how you can drive local clean energy policies so that the structural determinants of health that affect people of color in your community are supported and transformed. Even thinking about historical policies, for example, redlining, which some of you may have heard of, and thinking about how we create new information and evidence to drive action. Number 2, education. That's where you come in. We need your help, and it's being creative about how we integrate this. Climate change is not an elective, right? It is an elective, but it shouldn't be. It should be integrated to augment and improve the quality of education that every single person has the opportunity to get throughout their training. And some of us, for example, me, I never had any of this structured training as a medical student or as a resident. I really had to think about it in my own way. And the fellowship was an opportunity for me to gain that time. More and more as we move forward, that will no longer have to be the case. And we need your help in scaling this across all different educational realms because it takes some creativity, but the students love it. And then the third tier is really thinking about improving our written and oral communication skills to get health leaders in the circles where solutions can be scaled from a health and equity standpoint, and that within our national policies within our international policies, and right here, institutional policies, right in your hospital, right in your clinic, we can have health and equity incorporated. Historically, environmental determinants of health have not been incorporated. Historically, carbon footprint of healthcare systems have not been incorporated. What does a new system of transformation look like moving forward? And it's going to be up to all of us to either deal with the consequences of not transforming for our entire careers, or say, we are addressing this and here's the new standard that's going to be set. All right, you can go ahead and click through Bar to the bolded bullet. So if we look at the bottom, learn climate sciences, in a one-year fellowship, it's pretty rough. You think about moving across the country here for a year and moving somewhere else. It's really a challenge for us as educational leaders to, at the very basics, teach the climate sciences. And so this is weekly didactics right now, assigned readings from the literature, and looking through these thousands and thousands of pages of reports that have been demonstrating robust scientific evidence on the health harms related to climate change since before I was even born. Next, we connect fellows with longitudinal experiences with government agencies and offices. So if you are not familiar with the government, it is a little like medicine in that it is word salad. There are, the CDC and the SHMO and the CHA and the CHIG. And it is a learning curve for anybody walking into this very dynamic, high-paced space. So we connect them with different organizations and groups where they have an assigned mentor, and they can experience just a little bit or a lot of this, all of the different scientific bodies that are driving policies at the government level. Certainly participating with non-governmental organizations is another goal of ours, where we connect academia with local health organizations and leaders. This is important, for example, healthcare without harm. If a fellow is really interested in reducing the carbon footprint of the health system, what is being done locally as well as internationally in these spaces. Expanding the climate and health network, and a lot of this is supporting through travel stipends in order to present their work, in order to convene with non-traditional partners in environmental sciences, meteorology, and then really improve their written and oral communication skills. Applying their knowledge in policy and educational arenas. Some of these fellow graduates will go on to run educational programs, will be able to partner at institutions outside of Colorado and in these spaces where they may be the sole leader in their community or in their state, and they can really challenge the traditional university settings and help give students opportunities to lead scholarship and research. And then lastly, it's really thinking about this as a system transformation. How can we use our collective potential and innovate current practices? Next slide. Here are a few examples, just a few of all of the work in the last several years that we have done. And Beth and Bar have been leaders without a doubt. Going to LA and talking with celebrities as part of the Environmental Media Association, saying, this is what it means for our patients, especially those most vulnerable to the effects of climate change. Here's what it means for our patients in jails and prisons who are unsheltered, who are in low wealth communities, who are people of color. Going to the United Nations Climate Change Conference and speaking with World Health Organization leaders and talking about what it means from a disaster preparedness and prevention standpoint. Presenting scholarship at conferences, being authors on the National Climate Assessment, writing resolutions to support our professional society organizations as climate change and health leaders. And then certainly working with medical students, residents, and others to really learn the climate sciences and what it means. Next slide. So if I would boil this down, it would be really to create change makers. I think a lot of people are scared of the word policies and policymakers. And so quite frankly, I think of policies as change. How do we break down the barriers and give our clinician leaders the opportunity to scale the solutions that each and every single one of us have for our patients, to amplify their voices and amplify what our communities need most? Next slide. And then it's really breaking down these silos. As change makers, how do we not make it the climate sciences and the medicine? How do we make it climate medicine? And again, we are paving the way here at Colorado, as you have heard already. And we thank you for your ongoing support and look forward to continuing the discussion. Next slide.
All right, and so moving on to CME, this is sort of our so the CU Climate and Health Program is now launching a diploma in climate medicine, and it's really sort of coming from this understanding that faculty development is a rate limiting step for climate change and health education. And right now there are some ad lib virtual resources from Project ECHO, from the Global Consortium of Climate and Health Education, Medical Society Consortium, and more. But it's really, you have to find what you're interested in and take the webinar, or you sign up for a short course. It's not really getting the full spectrum of climate change and health education, or planetary health education. And so here at CU, to sort of unlock this, we have conceived of something called the Diploma in Climate Medicine, which is going live in a couple of weeks with our first certificate. And so it's modeled after sort of the diploma in tropical medicine. So it's a 300-hour course split up into 5 certificates, which you can take ad lib or together to get the whole diploma. And it does have CME credits as well if you're taking the course. And it really is divided into these certificates of, the first one is really foundations and updates in clinical medicine. The second one is developing sustainable hospital systems, then thinking about disaster medicine and both response and recovery, and then thinking about community resilience, really thinking about, you know, what do we need to know as health professionals about energy innovation, and how do we apply those lessons to a healthy infrastructure that really get at those underlying social and environmental determinants. And then lastly, really think about global challenges. So that's our diploma, and the hope is that, you know, we're really able to, again, scale our expertise in this area, bring in more specialties as well as other health professionals. So this diploma is not just for physicians, it's for any member of the clinical care team that's involved with direct patient care, but really sort of envisioning this as, you know, a collaboration with our behavioral health partners, with our nursing partners, with our social worker colleagues, and really bringing everyone to the table as well as every specialty. And so that is an overview of what we're working on here at the CU Climate and Health Program. But just to sort of switch to something a little bit more interactive, if you guys can, you know, use the following QR code. We've compiled a list of basically planetary health education resources. So if you can pull these up, and then we're not in person, so we'll try to do this virtually. The goal is to really try and share with the group how you might think about starting to teach climate medicine in your respective programs. And so you can drop ideas in the chat or raise your hand, and we'll ask you to unmute. And I'm gonna put this up for about another 30 seconds, and then I'm gonna put the link to the Google sheet into the chat as well.
I have a question while people are looking maybe?
Yeah.
And I think James just raised his hand at the same time. So thank you so much, Bar, and for bringing everybody here, Caitlin and Beth for joining as well to talk about this. I had two questions. One related to the last topic we were just talking about the diploma and where structural racism fits into that. Is it something that is not as a separate certificate, but is it something that's part of the conversation? So that was sort of my first question about that. And then the second one, maybe, I don't know, Beth might be the better, or Caitlin might want to charge into this question, is about how we manage the different levels of learner knowledge when they come into the space. So some of the feedback that we've gotten about our lectures that have come so far is students saying like, you all are old. I learned this in elementary school. I'm already all about my carbon footprint. I'm vegan for a reason. And they tell us you're not up to where we are, which I love about learners, but also is a challenge of like, where do you start, especially if you have faculty that you need to bring along here, but you have learners who are coming in it from already saying, I know about this and I'm worried about the future of my own family. So this is why we're so aggressively being there. So two questions, structural racism, and then that other one, and then James.
Yeah, I would say that health equity and environmental justice and climate justice. I think in the climate space, I think of health inequity as really pretty broad. And so I think about intergenerational inequity. So, the impacts on pediatric populations. I think about equity in terms of healthcare workers and our maybe increased exposure to climate stressors, as well as, racial and socioeconomic determinants, as well as historic racism and that sort of thing. And I would say that one way that we sort of try to really keep that at the forefront of our conversation is intentions, right? Like all of our learning objectives always address that as being something that we need to cover. And then the second part is really partnership. So we partner with a lot of other organizations to help deliver the course content who are experts in helping to address some of these inequities. Some of them are local organizations and some of them are national organizations. The National Medical Association is one of our partners, but it's definitely the backbone of climate change and health education at any level. And it's definitely, I'll let Beth and Caitlin kind of take the second question, but yeah, I agree. It is a moving target and Gen Z is here.
Yeah, I'll try to answer that one because I've already, felt the shock of, being called old and, that you're not teaching me anything because I already have learned this stuff forever. But I think part of that sentiment from the couple of students that I've talked to is really packed. Like, I know all this is one. And then I kind of, the activist in them is talking to, like, I wish that, this was in more places in the hospital, in the curriculum, and why aren't we there yet? So I guess I don't want to read too much into it, but I think if, we had like a general plan, if the students could see that trajectory of this is where we want to go, and there are these mentorship opportunities and there are these leadership opportunities for people who already know everything and want to, there are opportunities for action for them. I think that would be engaging for them. And then for people who are, those one or two students who say, climate change doesn't really exist. There will be those as well, but I don't think there'll be that many. But, to just set the stage as this is the curriculum, and we're going to give a couple overview lectures, and then we're going to have it integrated in as many places as we can. And there are going to be opportunities for people who are at that next level and wanting to be advocates and activists. I think it is one way to fulfill that need. So I don't know if that answers the question. I don't know if that would answer their question. I would love to have somebody like that here, but from that perspective.
I would say, just adding off of what Beth said as well, it's a really beautiful thing to get this two-way knowledge transformation working with these students. And I've had students who are physics majors, and they were essentially built carbon emission testers for the mufflers to measure emissions from our healthcare vehicles, right, at our hospital. It's a beautiful partnership when they can teach you and you can teach them very different but necessary skills. And so I think moving forward, it attracts people like us and tends to be generalist, but it doesn't have to be, who are open to breaking down some of those traditional hierarchies within academia. And you can kind of challenge each other and create really, really positive outcomes. I'm going to go ahead and pivot to Dr. Carter. I know he had a question as well.
Thank you. This was a fantastic presentation and overview. I really appreciate it. When I consider what you're trying to do, I tend to think about learners on all levels who are also teachers on all levels. And what you identified at the near the end about the faculty development, I think is quite key, because that leadership tends to filter down to others. But I think there's a challenge in the fact that we still have a clinical care model that's silo-based and pharmaceutical and procedural driven. And I find, particularly in my specialty of cardiovascular medicine, I get the glazed over look when I want to talk about the context of the patient's presentation, when the learners just want to give a statin or give a direct oral anticoagulant or send a patient for a stent. So I do think there's a challenge here. And I think one of the ways is to figure out how to integrate this faculty development into the fellowship training model and try to have an impact that way. Secondly, I love the concept of elevating the community voice. Probably every presentation I tend to think about that because of my role as Director of Service Learning for the new curriculum. And I think there are some other areas where some of this good work is going on, and we actually don't even think about the fact that it's already on our campus sometimes. And maybe there's an opportunity to elevate that and expand that even more. So I look forward to working with you to do that.
Yeah, I'll just say to that point about, you know, I especially see it in residency, because when I'm giving the talks to medical students, they're often, you know, very grateful that they're getting the lecture or the talk or, you know, the session. By the time we get to residency, you see clinicians start to get more and more strapped for time. And so then they're like, what does this have to do with my day-to-day patient care type of thing? And that's always the question that comes up. And I would say that really the point of thinking about integrating planetary health into your education is to have really put on your glasses so you can see clearer. Because when you talk about something like a statin, when you think about, you know, risk factors for premature mortality on a global level, number 4 is air pollution, which is climate sensitive, and number 7 is LDL cholesterol. So even when we're trying to teach evidence-based medicine, I would say if you're not paying attention to environmental health and planetary health, we're not actually doing it in an evidence-based manner. It's not congruent with the science. And so really, yes, we have a younger generation that's far more keyed into this, but it's because this is their lives. It's going to impact them more. And that doesn't mean that from, you know, chairs, program directors, down to faculty and clinical instructors, that we have a duty to really catch up to them and then try to provide our expertise as clinicians and really kind of provide that mentorship in terms of how do you practice medicine with an evidence-based space while there's some uncertainty.
And if I can add to that, I think we have redefined what evidence is. Unfortunately, I'm old enough to have seen that happen. And we have narrowed the definition of evidence. And I think there's an opportunity here to expand it back to include clinical science, biological science, foundational science, and experience. Again, elevating the community voice is part of what evidence is. Their narrative and their experience is evidence.
What a rich discussion. Excellent, everyone. We're coming up on the top of the hour. Any last questions for our panelists? I want to thank you so much, Caitlin and Bar and Beth. Thank you so much for being here today with us. If everyone could click in and fill out your evaluation, that's helpful for everyone. And also, this has been recorded, I believe. Yeah, it's recording, and will appear on the Academy of Medical Educators website in a little while. So thank you so much, everyone. Have a good rest of your day.
Thank you so much for having us.